Good morning, everybody. This is a meeting of the Integration Joint Board Clinical Care and Governance Committee, and it's a hybrid meeting, so some of us are in the room and some are on screen. I'm really pleased to welcome some of the new faces that are here in the room and on screen. So, first of all, can we start with the apologies?
Yes, Chair, we have apologies from Tris Cassidy, Francis Dodd, Stephen McAllister, Victoria McCrae, Andrew Murray, and Roger Ridley, although Roger Ridley may join the meeting.
Okay, thank you very much. And do we have any declarations of interest this morning? No. Okay, then we'll move on to the action log. Minutes of last meeting. Missed that bit first. The minutes of last meeting are the first item on the agenda. Does anyone have anything they want changed or anything they want to comment on or ask about in the minutes from the previous meeting? That was a meeting of 22nd of September. Okay, thank you very much. So now we'll move on to the action log. This is a rolling action log. Now, a number of the items were put in the action log as being for the 24th of November 2023, but for a variety of reasons that meeting was unable to go ahead, and this is a replacement for that meeting, 24th November. So those items are on today's agenda instead. Anyone want to ask anything about the action log? Okay, in that case, we'll move on to the overview of local oversight arrangements. And I think Suzanne Thompson is going to lead on that.
Thank you very much, Chair, and good morning, colleagues. The report presents an overview of local meeting arrangements and work relevant to the Health and Social Care Partnership. It's intended to provide assurance to the committee of the arrangements of its business. The report includes updates on the Public Protection Chief Officer's Group meeting and agenda items that considered at the meeting on the 13th of September. This is set out in section 4 of the report. It includes an update on the significant Forth Valley suicide and drug prevention work to progress the multi-agency drug-related death review process. And within this report itself, at section 9, we just noted the information provided for the committee. An update on the new Alcohol and Drug Partnership Executive is included, and a further report will be presented to the IGB in March, and that will set out these arrangements in more detail, including the revised terms of reference and membership of the new executive. At section 5 is included an update on NHS Forth Valley clinical governance arrangements. The Clinical Governance Committee agenda items for the meeting on the 5th of September last year are set out in Table 1 at 5.4, and the agenda items for the Clinical Governance Working Group meeting on the 31st of August are also included in the report at 5.6. Care home assurance work is provided, including the 167 reviews that have been completed in the 6-month period from April to September last year, with noting that a further 237 reviews will be completed in 2023. And an update on progress will be provided in the next report to committee. The Development Day hosted by the Adult Protection Committee and Child Protection Committee on the 24th of October is also set out in the report. And an update on the ADP and MAT standards as at April last year is included as the most recent Scottish Government assessment at the time of the report last year. Work has been progressing in relation to the MAT standard, and as I mentioned earlier, an update will be provided to the IGB in March. The Health and Social Care Partnership Clinical Governance Management Group is included as an update in section 10, and similarly the Health and Safety Management Group in section 11. So in conclusion, the report provides an overview and is intended to provide assurance to the Clinical Care Governance Committee, and the recommendation is for the committee to consider incorporating the report in section 2.1. And many of the colleagues who attend these various groups are in attendance. Happy to take any questions. Thank you.
Okay, thank you very much. And the thing that kind of jumps out under the MAT standards that that one has moved from red to amber, which is obviously a positive. So well done those who've been involved in ensuring that level of improvement between 2022 and 2023. Does anyone have any questions or comments that they want to raise? I will take it that that's because this is such a thorough and clear report, so very well done. So can we sorry, there are no recommendations apart from to consider and comment. So we have considered and commented. Okay, item 6, inspection reports. And I think that would be you, Gail Woodcock.
Yeah, thank you, Chair. So just to introduce this report. So this is a standard report that comes setting out a summary of all recently published inspection reports that have taken place in the reporting period. So within this report, there were there's information about 3 inspections that were undertaken by the Care Inspectorate during the period that the report covered. So that included an inspection of Summerford House, of Thornton Gardens and Grahamston House. So for Summerford House, the inspection noted a number of positive aspects of the service delivery and how well we support people's wellbeing and the leadership. So it scored 5s, which is very good for all aspects that were inspected at the time. So we're really pleased with that. Thornton Gardens was also inspected, and again, it scored 5s, which is very good across the board for all areas that were looked at. Grahamston House, while it scored a 5, a number of areas of improvement were identified and a number of requirements. So it scored 3, which is adequate overall in relation to how well we support people's well-being, and how good is our leadership, and then it scored a 4, which is good. So it identified a number of requirements that we were required to put in place by the end of December 2023. That included areas where we must have appropriate malnutrition screening tool use, and training required in relation to dietary requirements of the service users on site, and in relation to snacks and meals being offered throughout the day. And there are a number of areas of improvement. I'm pleased to say that there was a re-inspection earlier on this month, and the report was published on the 11th of January. The detail will come in the next report to this committee, but I can confirm that all requirements were met and all recommendations that were looked at were also met, and we've been rescored as 4s, which is good in relation to all elements there. So we're confident that swift, decisive action was taken by the senior leadership on site, and mechanisms are being put in place to ensure that those improvements are sustained into the future as well. Finally, the report gives a brief update on NHS Forth Valley escalation. Just for information, there's not any further updates that I'm able to give today. So we're asking the committee this morning to consider and comment on the content of the report.
Okay, thank you very much, Ian. I think we have to give our huge thanks to the staff, all the staff and managers involved in Summerford and Thornton Gardens, in terms of that's an excellent, it's not excellent, it's a very good inspection report. I think the only step further than that is excellent, which is always very difficult to achieve, and it would make us worry in some ways if it was excellent. There's no way for it to get any better. So a big congratulations and thanks to all the staff and managers who've been involved there. I have to admit, when I read the report, that in terms of Grahamston, I was surprised, having had a visit to that facility. I've been very, very impressed with the atmosphere, the staff, the way they operated. So I'm glad that there has been an improvement now, and work on the basis that it was probably just a glitch, sort of changeover of staff or changeover of something, because I certainly was very impressed when I visited the centre. I visited with a colleague who's our our older person's champion, Councillor Kelly. He loved it as well. Thinking of booking a room. So I'm glad to hear that it is improving. So well done to the staff who've done that. Does anyone have any questions or comments? Thank you very much then. So that is us we have considered and commented. Item 7 now is the duty of candour annual report, and that will be Linda Benny, who's on screen there, that will be leading this.
Thank you, Councillor Hannah. You may be aware all health and social care services in Scotland have a duty of candour which came into effect in 2018, and it's a legal requirement which means that when an unintended or unexpected event happens that results in death or harm as identified by the criteria within the Act, then the people affected need to understand what happened to them and receive an apology. Part of the legislation is that the health and social care have to produce an annual report with information on what we did in the cases where duty of candour were triggered. It's quite strict criteria. You may be aware that professional duty of candour routinely happens between clinicians and their patients, but the organisational duty of candour, which is what this refers to, there are quite strict criteria, and it is activated, for example, the death of a person, the permanent lessening of body, sensory, motor or physiological or intellectual functions, harm and treatment by a registered healthcare professional. So I have included the Forth Valley Duty of Candour annual report in this set of papers. I don't know if you've had the opportunity to read through them, but I'll go over some of the key things with them. Because it's an annual report and we're dealing with reviews that take quite a while, sometimes 6 months, sometimes longer, to actually understand what happened and what went wrong, it's difficult to find out if it was triggering duty of candour until we've completed the report. So during this time period, there were 13 completed significant adverse event reviews, which had been commissioned in the previous reporting period, 10 of which were organisational duty of candour. And then there were a further 14 commissioned during the next time period, and there was only 1 completed. So that meant there was 11 duty of candour that we could say were definitely organisational duty of candour. We've still got some to conclude, so we don't know if they're duty of candour or not. But to provide assurance, every duty of candour has undergone our significant adverse event review process, which follows the contacting the patient, making sure the patients and families are involved in the process, including them in the review, making sure that their questions are answered as part of the review process, and sharing the report with them at the end of the process to make sure they're happy that their questions have been answered, and obviously offering that apology. So it was just to give you an update on the duty of candour for NHS Forth Valley for that time period.
Okay, thank you very much, Linda. Obviously, this is one of those reports where what we really want to see is nothing to report, and it is obviously a matter of concern where there is something to report. But I think that it needs to be seen in the context of the number of people that are dealt with, the number of patients who've been seen. Does anyone have any questions or any comments? In that case, we have considered and commented on the report. Yeah, that's coming through today. So on to agenda item number 8. This is the Healthcare Acquired Infection Performance Report and September 2023. I have Jonathan Horwood down as bringing this forward. Is he here? Oh, he's just joined. Good morning, Jonathan. I was just realising I hadn't seen your name up there. So welcome to clinical care, sorry. Oh, sorry, it's the complaints report first. I do apologise. We to start taking these off as I go along. I'm jumping ahead, Jonathan. Before your report, we have the Health and Social Care Partnership Complaints and Feedback Performance Report from July to September 2022. And that'll be Gordon McKenzie. And welcome to you as well, because your name wasn't there at the start either.
Thank you, Chair. Good morning. Go to the report, the main elements of the report, I think, to draw out for you today. The table 4.3 shows that the number of complaints has remained fairly steady the last couple of quarters, 19 in quarter one, 16 in quarter two. The number of complaints, stage one complaints dealt with within timescales improved from 68% to 81%. We had a problem last year, as you might recall, where the complaints performance in terms of timescales dropped. We've now got 3 quarters where it's significantly above what it was last year. So I think it's trending in the right direction, but we keep a focus on that and keep reminding team managers amongst their very busy workload to keep a focus on the complaints, and that seems to be maintaining the response within timescales and improving it. In terms of the stage 2 responses, numbers are very small. In the last quarter, there was 1 complaint that was without timescales. There was 1 complaint within timescales, and the third one straddled the timescale and was included as non-compliant, but actually it was within timescales at the point that the report was taken. Similarly, in table 2 below that kind of gives you the half-yearly picture, and again it's going in the right direction in terms of time scales for the larger complaints, which is stage 1. In relation to, well, the other I should highlight is at 4.7, where we're now able to give you a bit more detail on where the complaints are coming in from. There's been various improvements going on in the background, and we're now starting to see the benefits of that. So there's a breakdown there for the social work adult services areas of activity around number of complaints in each area. As one might expect, there's a significant number from home care. That's a large area service. We've got 700 or 800 service users in that area. And in the MEC service, we've got something like 3,500 people who are part of that service. So overall, the numbers, there's any complaint where, we want to resolve that and stop it, prevent complaints from happening again. I think in terms of the overall context, the numbers are still relatively low. I think I'll conclude it there. I'm happy to take questions now or after my NHS colleague has done their bit. Thank you.
Okay. I'm not sure I can know who's I'll be Ailey picking that one up. Right. Thank you, Ailey.
Thank you very much, Chair, and thank you, Gordon. It's quite a similar story from the NHS arm of complaints at the minute. There aren't a huge number that come in each month. That's remained relatively static. On average, they're around 5. There have been 43 complaints received year to date. The information presented within the formal paper is for the last quarter. Overall, at organisational level at the minute, we do have a delay in complaint responses. The performance within Falkirk has fluctuated. December's performance was 100%, which is the highest that anybody had. So very well done to all the teams for managing to get the information through to let us conclude those cases quickly. There are overall organisational pressures, though, which is the result of that. There is implications that sort of fall into the HSCPs as well. Our teams are working exceptionally hard to try and clear that backlog, but it does mean that there will be occasions where even if we get the information, we just do not have the capacity to draft complaint responses on time. Within all of the acute directorates, there is a general ask at the minute that if there is anybody within local services that can support with drafting, that we're quite happy to kind of support with any training or development. And we would ask the same of the HSCPs. If there was anybody locally that could help with these processes, we're quite happy to kind of support through that. The year-to-date performance is 41.9%. Again, there has been a little bit of fluctuation, but we are seeing improvements throughout the kind of last few months that are all in the positive direction. The main themes that we are seeing with complaints at the minute actually relates to waiting times, which is a little bit, it's common that we see across the piece, but it's increased in comparison with the September data figures, and waiting times has overtaken the number of complaints that we're seeing about staff attitude and behaviour. Communication and staff attitude are still remaining quite high up there though, and the concerns that we're seeing noted. At the moment, we have got 2 open cases for Falkirk. One of those is going through the final stages of sign-off, and the other one is not due until the 9th of February, which means that we are expecting, hopefully, to continue to report that sort of improvement in overall performance. And we'll keep on trying to support that within our teams as best we can to keep that position going. Happy to take any questions.
Thank you, Airy. Are we stopping at that point? Because I see there's a section on compliments and feedback as well. Has that been covered?
So let me scroll. Sorry, I only picked up the papers for this morning. Let me just scroll and see what this says.
I think that's in fact the social work adult services.
Oh, is it? So that'll maybe go back to Gordon then, I'm afraid. Sorry.
That's where lost go.
That's quite, yes, sorry.
It's just, I mean, complaints are important and we will discuss those. But I was glad to see that there's a section here that's about compliments and feedback as well. So we should not ignore it.
Indeed not, Chair. And my apologies also. I'm actually speaking to outside the IT help desk because my laptop crashed this morning. So I only just picked this up in the last sort of half an hour. But yes, you're right. We've started using Care Opinion. We're getting feedback, positive feedback on a number of services, which there's a brief summary there, which is, and we feed that back to the staff as well, because it's important for them that they get to hear that, people do appreciate the service that is recognised by their managers, and it's definitely it's an improvement to the whole reporting mechanism that we're actually collating that positive response as well. Thank you.
Thank you. I think it might be best if we take comments and questions in 3 bits, looking first of all at the section for social work, social care. I had one question on table 2 on page 53, and it's maybe my stupidity, but we'll ask it anyway. The table, in terms of the proportion completed within timescales, in the last 2 quarters, it was 63% going to 74%, but you've got a down arrow. And then in the stage 2, it's 93 going to 71 and a down arrow again. So to me, the direction of travel in 63 to 74 is upwards rather than downwards, or depending on how you look at it.
No, you're right. You're right. That should be the other way around for that one. Yeah. Apologies. Thank you.
I was misunderstanding.
No.
Thank you for that. Right. Does anyone else have any comments or questions? Margot, yeah.
Just a quick question. Since involving Care Opinion, Gordon, would you say that this reduces the number of complaints because people can access the information they require without going through the complaints procedure?
Good. It's a good question, Margaret. I honestly don't know the answer to that. The number of complaints, as you see, they're relatively small, so it's difficult when numbers are small to draw too much from that. They've been stable, relatively stable over the last couple of quarters. So I don't know. I'll go back and I'll speak to those who deal with Care Opinion and see what they're saying about it and feedback to you. Would that be okay?
That'd be great. Thank you.
You're welcome.
Thank you. Airy, you've got your hand up, yes?
Thanks, Chair. Just if I can offer any insight from the our experiences within the health services for that, Margot. Care Opinion has a very, very high prevalence of positive feedback. So people tend to use Care Opinion to share their positive stories and their experiences with us. In the report here, there's a 13% of ratio for moderate criticality for health services. And what you'll find is that some people take that as a kind of quicker option to get access to service managers, etc., because it tends to be service managers that will reply directly. Sorry, I'm very tongue-tied this morning. Or the likes of chief nurses, etc., will reply directly to Care Opinion feedback. So it can sometimes be a quicker mechanism of what we would probably consider a stage 1 complaint. You might find that people use it if they've got families, relatives, or even themselves currently in an inpatient area, currently going through an active healthcare sort of process, and they would then use that as a really early opportunity to link in with local managers. Overall, though, as I've said, it's primarily positive stories that go on Care Opinion, which is really nice to see. And as Gordon says, we make sure that those are shared with the staff directly, so it offers a little boost to how people are feeling, just to get those positive stories fed back.
Thank you.
Thank you, Eri. I think that's really important, because it often is the case that we only have responses from people when something goes wrong. So it's important that when we're getting positive responses, it is getting fed back to staff. They give a bit of encouragement. Yeah. So thank you, Margot. Did you have another question, or was that? Oh, you're all right. One of the things I wanted to say was Gordon very helpfully, when going through the figures on social care, talked about, this is complaints in a certain area in home care and in MEX who have X number of clients. And I think the complaints numbers do need to be seen in that context, that these services are very, very busy seeing many, many people. And I think it's important. The other thing I wondered is if there's a way of having almost a section in this report that is about saying, what have we learned from this? Because the important thing about looking at complaints, investigating complaints, is to see what has gone wrong and see what we can learn for the future. Obviously, for the individuals, the important thing is that they get a resolution to their complaint. But for the organisation, we must learn so that we can make sure it doesn't happen again. So I just leave that for people to think about, if there is a way of adding a wee section that's just about what we've learned and if we're changing things. Sorry, Gail, you want to come up?
I think that's a really important point to raise. And ultimately, it's sort of what questions in terms of what do we do with the information. So I'm just thinking we've got our clinical and care governance management group, which is the group that sits at operational level. And I think we'll take that into that group in terms of how do we make sure that we are adequately teasing that out and capturing what we're doing as a result. The other thing I was going to add in terms of the compliments bit, so it's probably quite important to recognise that not everybody puts in a compliment through a formal process. And I know that our service on a daily, weekly basis are receiving compliments from the service users and their families in terms of the difference that the teams make in terms of the lives of the individuals they're supporting. So the richness of that isn't fully captured through our formal systems, but I sometimes get copied into email and things like that. And it's really touching to hear the real difference that our services make at really difficult times in people's lives.
And we as counsellors also get that when we have contacted the service on someone's behalf. And maybe that's another area we should look at trying to capture. Like Gordon?
Yeah, just for information, Claire, in the annual report, we give some of that information around what we've learned from complaints as part of the annual report that I think we did in the previous meeting, which is now, 4 or 5 months ago. Maybe we could do that on a more regular basis rather than just in the annual report, without sort of meaning that we'd be identifying anybody. So just have to be careful about that, but I'm happy to bring back information on how we learn from the complaints. Absolutely.
I think it'd be useful in terms of being transparent. I have no doubt whatsoever that action is being taken where you have learned. from what has happened. It just seems worthwhile to be reporting on it.
I think there's maybe a factor of people reluctant to make complaints. Dare I say it, because they fear sort of repercussions on their relatives, etc.
Yeah.
So I think that's something that maybe has to be addressed, and that people feel they can make a complaint without it having any detrimental effects.
Yes. I think that's a really important point, Margot, that many people just brush it off and say, well, that's life. And perhaps we could learn more if they were not. And it's important that we're constantly making our complaints procedure transparent and easy to access for people. So I just leave that as a comment for staff to think about, managers to think about. It's a really good point, Margot. Okay, have we adequately considered and commented on the report? I think we have indeed. So now we'll come to you, Jonathan, for the Healthcare Acquired Infection Performance Report for July to September 2023.
Okay, thank you, Chair. Good morning, everyone. So this is the quarterly report for July to September. And if I may, I'll give you a quick update of where we are to date as well, just to give some context to everything as well. So in terms of COVID numbers, you know, the between July and September, we had on average around about 20 inpatients across the hospital sites on a daily basis. That has now reduced. We're now sitting around about 10 inpatients or thereabouts, or in the early teens of inpatients now. So we know numbers have reduced to, I would say, probably like a baseline level now. In terms of outbreaks associated with COVID, in September last year, we did have one COVID outbreak in Bowness Ward 1. Fortunately, there have been no subsequent outbreaks to date in either Falkirk Community Hospital or Bowness Hospital, so which is good. What we're finding across Forth Valley, the biggest challenge, or the emerging challenge, is now influenza. That's and our numbers are more or less twice that of COVID currently as an inpatient. We know it's quite apparent now within the community. So we're still waiting whether or not numbers will increase sharply. That in previous years that we've seen influenza numbers rise very, very quickly. As in patient activity. We haven't seen that yet, although we have seen an increase, but we're sitting around about, today we have 21 patients in with influenza. Compared to last season around Christmas time, we had over 65 patients. So the numbers are a lot lower than we're anticipating. We know that the season is a bit later than previous years, so whether or not we enter into a higher level of influenza activity, only time will tell. But so far, we haven't seen that peak currently. Moving on to care home support, that is going well now. We've now, at the end of this month, we've completed our first cycle of all audits across the care homes. As you're aware, we used baseline data from the summer visits, where we visited every care home in every month. We use that data then to determine whether the frequencies of our visits. So we've come to the end of that first quarter, so we're going to reassess it to see whether or not we need to increase frequencies in certain care homes or not. In October last year, we actually hosted our first dedicated infection control training day for care homes, hosted in Stirling Community Hospital, and we had over 40 attendees, and overall feedback was good. As numbers, we are finding our non-compliance rates falling within care homes, which is very, very positive. And, you know, we are hoping come next month to roll out proactive infection control training to care homes. And we've been discussing this with care homes in the last couple of weeks, and has been received quite positive. So people are very keen on engaging with that. We are getting engagement with care homes proactively when they say they have new staff members joining and they'd like us to give them some some infection control training. So things are going quite well there. We're hoping to have another training day for care home staff in springtime of this year. Moving on to our AOP targets, as you're aware, just to give you highlights of some of the relevant points. Our E. coli bacteremias, as you're aware, our numbers were a little bit higher than the national average, and we were exceeding control limits. And as a result of that, the Scottish Government evoked the support framework to Forth Valley in reducing our E. coli numbers. Our E. coli bacteremia numbers have fallen, and now we're sitting within the national control limits, and as a result of that, now the Scottish Government support has now ceased. That stopped back in October, which is good. So we can that's something very positive. Just to highlight as well, also our AOP targets recently been informed that they are under review and they're likely to change before March 2024. So we'll be able to let you know and what new targets are going to be set. From a national point of view, they're not meeting any of the targets currently. So whether or not that has had an influence on the review of the targets and whether or not they're relevant, or if something needs to be changed. But again, I'll let you know once we get that and in subsequent reports. In terms of our Staph aureus bacteremias, our device-associated bacteremias, and C. difficile infections, there's no issues to highlight. The numbers remain relatively stable, including this last quarter from October to December as well. So nothing to report there. So overall, and also there've been no infections reported from Staph aureus bacteremias, device-associated bacteremias, or C. difficile infections in either Bowness Hospital or Falkirk Community Hospital. Happy to take any questions. Thank you.
Thank you very much, Jonathan. Really pleased to hear about the training for care homes in terms of infection control. I think during the worst of the COVID pandemic, it really did highlight the importance of cleanliness, basically, within our facilities. So I'm pleased that that's being taken forward, because sometimes when the immediate danger passes, people go back to their old ways. So I think it's really important that that's ongoing. Also pleased to see that, although you're saying that E. coli, Staphylococcus, and C. difficile incidence is fairly stable, and it is, but if I'm reading their graphs correctly, it is a slight improvement. It's going down slightly, the overall trend.
Overall trend, yes. Generally speaking, our E. coli's and our Staph aureus and our C. difficiles have fallen. We do know some of these infections are seasonal. C. difficile infections generally rise in the autumn, winter times. So in the last quarter, we have seen a little bit, increase, but nothing too dramatic. But we expect that from our own evidence and also nationally as well, that's expected. And we know our E. coli bacteremias tend to increase during the warmer months when people, become more dehydrated, and then they have more complications like sepsis associated with urinary tract infections and so on. So yes. So overall, looking okay at the moment. Thank you.
Thank you very much. Anyone else have any questions or any comments?
It is just a
Marco,
question, and possibly my own ignorance, but is norovirus a factor in this at the moment? Because I believe there's quite a lot of norovirus.
I don't know what's going on in the community hospitals, because the health protection teams are now regionalised, so we don't have that soft intelligence from the team based in Forth Valley. We have had in the acute hospital, we've had one outbreak this year of norovirus, but we're touch wood, we're not seeing a great deal of it so far. which is good. Norovirus is a very, very tricky one to control within an enclosed environment, and you will see that with schools and nurseries and so on, with closures there. So it is highly contagious in an enclosed environment, if you like, But so far, we don't have any on site at the moment, patients with norovirus. So far so good. Long may it last as well.
Thank you, Margaret. Thank you, Jonathan. Anyone else got any comments or questions? I did think it was interesting that now flu is bigger than the COVID situation, which is good in terms of COVID, but not so good in terms of flu. So,
yes.
But it's an important change in the pattern. Okay, in that case, if no one has any further questions, then can we agree that we have considered and commented on the report? Here, that takes us on to item 10, the Clinical and Care Governance Committee Governance Report, and that would be you, Suzanne Thompson.
Again, Chair. The report proposes approval of meetings for committee and also an indicative forward planning for 2024. However, due to the unforeseen circumstances that meant the member to meet last year, the decision was taken by the IJV in December around our programming times for this year. However, as it does contain a recommendation to consider and comment on the forward planner and forward to date for consideration. The planner itself aims to ensure alignment with the clinical and care governance framework and our terms of reference, and it will also be subject to changes over the year dependent on pressures and priorities as they emerge. And where this happens, we'll be making any changes with the committee. So, summary of the draft forward planners attached at appendix 1, and happy to take any comments or questions. Thank you.
Okay. Thank you. It was good that the IGD was able to pick that up following the fact that the season chief wasn't able to go ahead last time. So thank you for organising that. Linda, yes?
Yes, thank you, Councillor Hannah. I just wouldn't like to raise unrealistic expectations, and the duty of candour, because it's the financial year, we wouldn't actually be able to finish collecting the data until after the 31st of March. Then it would have to go through our local Forth Valley clinical governance processes prior to it going to the board, prior to it getting available on the intranet. So realistically, I think possibly the September meeting, we would be able to share the report rather than March, if that's okay.
Is that okay with everybody, and can that easily be changed?
It can. Probably what I would add is we appreciate there's a lag time with the duty of candour reports coming forward in terms of the due diligence, the due processes that needs to go through in terms of for Zara, the Chief Social Work Officer, duty of candour report, council and NHS. So March is actually probably it refers more to the previous year's duty of candour report to allow for that.
Oh, right.
The circumstances we were able to bring forward the NHS report at an earlier meeting in November, but apologies if that's got some confusion. But we can amend it to September, I think, for the council one. Zara, would it be correct in saying that's probably still too early to bring the social work one forward to clinical care governance?
Well, Suzanne, it's absolutely fine if it's the previous one. That's fine.
Okay, any other questions or comments? In that case, we have considered and commented on the draft forward planner. And we can move on to agenda item 11, which is national publications. Highlights the things that I should have read and maybe haven't. So, and that'd be you, David.
Yes, thank you, Chair. So during the from the period 22nd September up until November, there was a total of 7 reports that were deemed to have relevance to the Clinical and Care Governance Committee, which were published. And we have this as a standing item in case there's any national publications that we need to consider across a wide range of settings. As you'll see at 4.1, we have a table there which presents links to 2 reports from the Mental Welfare Commission for Scotland, 3 for Scottish Government, 1 for Health Improvement Scotland, and 1 from the Chief Medical Officer. I'm not going to go into any sort of detail in the reports because of some of these provided at section 4. However, I would just like to highlight the second report, which is presented in the paper, the Short Breaks Landscape Review, because that does provide a local summary of what we've been doing locally to date. So at 4.6, you'll see a commentary saying that locally, ensuring that we keep up to date with national developments with the bill and planning for the right to break. And there were staff who are part of the Scottish Government Right to Break regulations and guidance group and advisory capacity, also linking closely with Shared Care Scotland. There was also at 4.10 an update around recruitment for a new carer social care officer to the team. I'm not sure if that recruitment process had concluded successfully. I don't know if anyone knows, Suzanne. And other than that, Chair, I've just returned to the recommendations of the report, which is to consider comment on content of the report.
Okay, thank you very much, David. As I say, I find these summaries actually very useful because for lots of people it's kind of difficult to look at these reports in full themselves. So I'm sure there are many people who find it useful to help them to keep up with what is happening. Does anyone have any questions or comments? In that case, those that we have considered and commented on the content of the report. And that brings us to the end of the agenda. Is there anything anyone else feels they need to raise? That case, I say thank you very much to everyone. And I hope you've all got a weekend that you're going to enjoy coming ahead. I know I have.